And Dr. Niels Mueller, who is a neurologist at the Delray Medical Center. Doctor, we are so pleased to have you.
Thank you.
And we know there is a topic specific to your specialty and discipline that we want to get to that is vitally important, but we would be remiss if we did not begin our conversation with news of Ebola and the doctor contracting that illness in New York City. Both personally and medically, how do you view Ebola?
Well, certainly the news of Ebola are very, very frightening for everybody. At the same time, I think we need to keep calm and look at it with a scientific aspect. We need to make sure that we do the appropriate infection control measures, that we isolate people who are obviously infected, that we protect the healthcare workers that seem to be most at risk. I think the population overall seems to be much less at risk, as we've seen by the experience in Texas. So I don't think there is reason for a panic. I think it's very, very important that everybody looks at this in a very calm way. And I think mandatory quarantines really haven't shown to be very effective. So it needs to be on a voluntary basis, that the people who are known to have some exposure seclude themselves for the 21 days if that's indicated and supported by the CDC.
Okay. So really you're here to talk more about strokes. We know National Stroke Day is coming up on the 29th.
Right.
And the new research is saying that women are actually more at risk than men. Why is this, and what are the risk factors?
Well, I think there's a number of factors that increase the stroke incidence overall. I think women live longer, and therefore it is easier to, over the lifetime, acquire strokes. So the stroke incidence in women increases. We are looking right now at about 800,000 strokes a year. By the year 2025, we're looking at 1.2 million strokes. And the older population that has an increase in the stroke by about double each decade after 55 is predominantly women. Therefore, we see a higher incidence.
So prior to 55, it's not such a concern?
Well, actually, it is also a concern. We see the incidence of stroke in people between 20 and 55 is increasing as well. The reason is that we are seeing more cardiovascular risk factors in the younger population. We see more obesity, we see more cardiovascular risk factors such as high blood pressure, diabetes, and also toxic factors such as smoking, etc. So those increased by about a factor 25% over the last decade.
Dr. Mueller, if I'm not mistaken, a couple of years ago there was an effort, at least with the public, to kind of rebrand strokes as brain attacks. I don't know if there's any veracity to that or if it's the same thing going on, but what are the first signs that people experience that they might be suffering a stroke?
Right. One of the challenges in stroke treatment is that it's a very rapid disease. You lose 2 million nerve cells every minute, so it's very, very important that people recognize the signs and symptoms and get the right care as fast as possible. Time is literally brain. So we have a mnemonic that we put out in the community that people become increasingly aware of, which is FAST.
Okay.
Face, meaning you have a facial droop, you have arm weakness, you have a drift in your arm, you have problems with speech, either slurring or word finding difficulty, then time is of the essence, so fast. And then you should call 911. It's been shown that once you call 911, you get better care, better access, better recognition of stroke, so don't come in by yourself. Use that, teach your school children to apply the FAST mnemonic. We've had grandchildren recognize strokes in family members. So it's a very encouraging trend that we're seeing with this public awareness campaign.
My father actually recently suffered a stroke, and he's relatively young. What can you do to protect yourself?
Well, there are modifiable risk factors, and then there are genetic risk factors. For instance, males overall have a higher incidence of stroke.
Okay.
You have a higher risk factor with certain genetic conditions which you cannot change. However, the majority is lifestyle. High blood pressure is still the #1 risk factor. So if you are aware of your high blood pressure and you're treated both by medical care but also by lifestyle, by diet, by exercising, then you seriously reduce your risk of stroke.
Is stress a factor as well?
Stress is hard to measure in scientific studies, so it's very difficult to say. I'm sure it's a factor, but it probably works indirect through raising your blood pressure, raising your cortisol levels, and things like that.
Now, do women have different symptoms than men?
Females present often with more subtle, less well-recognized symptoms, so often we see that women are not as easily recognized with both heart disease and strokes, but in principle the symptoms are the same.
I'm interested in FAST again, starting with the face. Is there a sensation that accompanies that change in the facial droop, something that somebody would sense, or is it just like looking in the mirror and seeing
Well, most people who have a facial droop also have associated facial numbness. So they feel like they've been to the dentist, and it's usually not just the face, it's the face and the arm, because the territories in the brain are very close together. So once you have those two symptoms together, you should be concerned. Numbness of the face by itself can have very benign reasons. But once you have the two and you have the risk factors, you should think about contacting a healthcare provider. And if it's severe enough that you are impaired, that you, for instance, can't call your family member, should call 911.
Now, if you feel like you might be experiencing symptoms other than dialing 911 and getting help, is there anything you can do immediately? Take an aspirin, anything that will help?
No, unfortunately, it's very complicated. There are many different types of strokes. 15% of strokes are actually associated with bleeding in the brain. In that case, if you take an aspirin, you actually hurt yourself. So you have to go get a CAT scan. You have to go to a center that has stroke processes in place. And there are different capabilities of hospitals. There are some hospitals that can treat you with the techniques that I do, like catheter-based stroke intervention. You won't get that at every hospital. So the paramedics really are currently learning which patients belongs in which hospital. We're trying to get faster because time is of the essence. We're trying to route patients directly to the most appropriate destination rather than going hospital from hospital to hospital.
Dr. Mueller, as you were outlining this, let's say people are experiencing these symptoms, and given the deterioration, if you're having a stroke, how are you going to pick up the phone and dial or punch in 911?
Well, unfortunately, we frequently get patients that are living by themselves. They are found down after a time that is undetermined, and those patients used to be from the beginning excluded from any therapy. We now have new imaging techniques that allow us to screen out patients that still have brain tissue that can be saved, and we can now take them to these modern therapies and pull out their blood clots and restore quality of life.
Wow.
Well, again, if you're physically unable, should you have some sort of monitoring device if you're of a certain age? Or
there are some patients that wear a life alert monitor or something similar. Most people, fortunately, live in an environment where there's a caregiver that can alert them. Unfortunately, there's not a lot of science to say whether you save lives by wearing one of those alert systems.
Well, time is of the essence,
Absolutely.
and unfortunately, time is something we have in common in treating strokes and in working in television. Dr. Niels Mueller, we thank you for your insights as we prepare to observe October 29th as World Stroke Day. Yes, indeed. Thank you so much, sir. There is much more to come on America's Forum, including our visit with James Herson, the right man on the left coast, but also ahead, a Newsmax Now update, and we'll be back with more following that update.